¿Estás listo? Estamos listos. Okay, what's the first one?
Manual traction.
No, that's not the first one, is it?
Reciprocal clicking.
Reciprocal clicking?
Yeah.
Okay. So basically get them to open up their mouth slowly and close and try to feel for any clicks. Now, you're not clicking right now, actually. Go in. And close.
Sorry.
A little bit of a click right there. You can probably see it in the video as well. So again, that could be an indication for TMJ. What's the next one?
3-knuckle.
Which one?
3-knuckle.
So 3-knuckle test is basically get them to put knuckles in their mouth, see if you can fit 3 knuckles, and it has to be, again, their fingers, not yours. Tammy. No, just kidding. Just kidding.
2.5.
In the book it says that they can fit, if they can't even fit, was it 1? Or if they can't even fit 2, it's a positive test. I say yeah, if they struggle, if they have pain with 2 knuckles, I would say that yeah, there's probably an issue with the TMJ there. What's the next one?
Anterior lateral leg flexors.
Okay,
Strength.
so arms like this, head to the side. You can start off right from the grade 4. Tell them to lift up their head about 6 inches from the table, and roughly about 5 pounds worth of pressure. And if they can resist it, that's grade 4. If they can't resist it, go down to the grade 3. Keep their head at this position. And if they're not wobbling, not struggling, that's grade 3. Yeah, exactly. And basically, if they are wobbling, if they are struggling, that'll be grade 2. And just like, go down. And if they put their head like this, and you tell them to lift it up, and they're able to engage their SCM, but their head doesn't come up, that would be a grade 1.
Sorry, were my arms supposed to be up for this one?
Yeah, I don't think grade 1's even in the book, but if they can, basically what it would look like is just like this. You'll see an engagement in the SCM, but they can't lift up their head. That would be grade 1. You won't. Most of the time, you won't see. Most people can get it up, but they'll have issues with it. People who have who've been in car accidents, they'll have when they'll lift up their head like this, their whole head will start shaking. Their SCM will be in spasm. You'll see that with whiplash. Let's just the complete opposite, but face down.
Okay, manual traction.
Okay, so this one, if he presents with usually any kind of neurological symptoms, oftentimes down the hands and fingers. So that'll be from basically the nerve roots would be C5 to T1. So one way to find out if it is coming from the neck is to put your hands underneath the mastoid processes like this. And you're not trying to strangle them, just light pressure, and then lift up just a little bit. You're not trying to make a giraffe out of them, just a little bit. If the neurological symptoms fade, if they go away, then that's an indication that it is coming from the neck.
Vertebral artery.
Let's skip that one.
One sec.
Did Tanya touch the vertebral artery, right?
Yes.
She'll be able to teach that one way better than I can.
Passive neck flexion.
Again, 1 in a million, remember? What the vertebral? Which one?
Passive neck flexion.
Okay, very simple. Do this incrementally though. So start lifting up their head like this. If they have any pain in the back of their head, back of their neck, this is a positive sign for dural tension. So again, go down. Start off a little bit. Ask the client, is there pain there?
No.
Lift up a little more, is there pain?
No.
And then when their chin is basically already tucked, then you don't go any further than that. That'll be passive neck flexion.
Straight leg and slump test.
Okay. Okay, very simple. So there's 2 ways of doing it. One, well, you're always going to have one hand over top of the knee. The way I like to do it is like this, and up to 70 degrees. The other way of doing it is just like this, whichever way you like it. But remember that the leg has to be straight, as is in the name, straight leg raise test. The second it bends at the knee, you're putting slack on the nerve. And we're assessing for pain in the back. We're assessing for neurological symptoms, actually. And if there are neurological symptoms, then yes, that would be a positive test. But as soon as you bend the knee, there's slack in the nerve. we want to put tension on that nerve. And don't go past 7 degrees. Again, sometimes they'll say, oh, you know, I have pain, but it's almost just like the muscles are pulling. It could be just hamstrings. But if it's an uncomfortable and it's like a burning type of pain or any type of neurological pain,
My toes were tingling.
were they?
That's a neurological.
That arguably that's a positive test. Did you have sciatica?
Not that I know of.
Okay, and do it the same for the other leg as well, guys. But you have to go around the table. Right? Okay, slump test. If I could just sit, just sit right there. So slump tests are 2 ways you can do it. You can start at the leg or at the head. So let's just start at the leg. And you have to be incremental. Any pain? No.
Just stretch.
Just stretch. Okay. Do a little bit of dorsiflexion like that. Ask them how's that feel.
Just a stretch.
And then you can tell them we can tell them to slowly start slumping forward, rounding their shoulders, and putting their head down.
Cool.
Yeah.
That's a good stretch.
Where does it hurt?
Right back. Just,
Is it a stretch or is it a little more neurological? You just say. Hard to say.
Combination. The toes were going tingly again.
Yeah, so that's a positive.
Okay.
Okay, so same thing you do on the other side, but let's do it the other way. You can start from the head. So tell them to start slumping forward like this. Ask them how they're feeling. You can round your shoulders too a little bit more if you want, yeah. And then slowly start lifting up the leg. Make sure you're incremental. How's that feel, Brandon?
Already starting to stretch.
Oh, yeah?
Mhm.
And then slow. Worse?
Yeah, not too bad.
Okay, if they're feeling pain, if they're feeling neurological symptoms, you don't have to do it all the way.
He's pulling back.
He was?
Yeah.
Yeah, so he's positive bilaterally then.
10-minute elevator.
I got him.
For 3 minutes. I don't do this test because I don't really have that. I don't really have 3 minutes. I usually just jump into the other toss tests. Should we do those real quick? The toss test? Is that what's after?
Yeah, costoclavicular,
Or the bicep bracket?
biceps brachii, and Addison.
Okay, let's do the toss test real quick first. So, person has thoracic outlet syndrome. These are the tests that you want to go to. So, all of them are predicated on assessing the radial pulse. All 3. So find the radial pulse. Not the over, the radial. Once you find it, you do. Opa. In the book, it doesn't say put weight on the shoulder. I like to do it because I like to approximate the first rib and the clavicle. So this would be the costoclavicular. We're seeing if there's compression between the first rib and the clavicle. And if there's a diminishment of pulse, or if you lost the pulse, or if it's weaker, that's a positive test. So he's testing positive. And then there's the Addison's maneuver, which is the exact same thing. But you don't put, I won't put weight on the shoulder. Same thing, find the radial pulse, put it behind them like so, and then just tell them to look away like this. Make sure they get a nice stretch on the left side. So in this case, you'll be putting slack on the right side of the scalenes, right scalenes. You'll be putting tension on the left scalenes. Assess, see if there's any diminishment of pulse, and then tell them to look the other way as well. In the book, they tell you to go only one way, but it's good to do both. This way, you're putting. Oh. Can you go the other way for a second, sir? So you're testing positive for this side. So that's the Addison's maneuver. Any questions on that? You don't have to put weight on the shoulder though, by the way. Were your fingers going up? Yeah. And then the last one was the rights for that one, right, Angel?
Yeah, did you do biceps brachii?
Not yet. I'm just going to do the toss ones.
Yeah, rights is after.
Yeah, so again, radial pulse and hyperabduction. This is a rights hyperabduction test. So I can already feel there's some tension there. Yeah, you're putting tension on the pectoralis minor. Underneath the pectoralis minor, you have arteries, veins, nerves. When the muscle is tight, it's not going to have give. So in other words, here's the muscle kind of goes like this. Underneath runs the arteries and nerves. If it doesn't have give, you lift it up. There's tension there, and it's going to start pulling underneath that muscle. If the muscle is loose and there's no issues there, it'll have give, and it'll give basically room for the arteries to properly, that's it. For for the toss test? Just the bicep brachii?
Yes. Hawkins Kennedy, actually, that doesn't count.
No, that's not for toss.
Didn't think so.
Bicep brachii, very simple, just like this. You're gonna tell them to hyper abduct this way and not curl. So tell them to go up. And if they have pain in their shoulder, that's a positive test for bicep brachii. Oftentimes people will come with shoulder pain and they'll think it's from the shoulder, but it's actually from the biceps. And up. And this one I find is oftentimes accompanied with positive Hawkins-Kennedy test as well. So in other words, there'll be an impingement in the supraspinatus, and then what will follow will be bicep tendonitis. So they oftentimes I notice these two tests go positive, hand in hand. Hawkins-Kennedy,
Yes.
very simple. Again, with this one you might be incremental because people have issues with their shoulder. So in other words, with him I know it's fine, but you don't want to do this.
Dropping.
Yeah, you don't want to drop. That can really hurt the shoulder, and perhaps in extreme scenarios it could dislocate the shoulder. So I would go like this, and if the person's in a lot of pain, just lift it up a little bit. How's that? Is that okay?
Mm-hmm.
Go like this. That's fine.
Mm-hmm.
And slowly let go. Look for signs of apprehension. If they're fine, then you can carry on with the test. Put a little bit of weight. How's that?
Fine.
And then tell them to externally rotate this way. No, it's like this. Sorry.
Oh, sorry.
Yeah. Any pain in the shoulder? If they have pain when they're doing the external rotation, that's a positive test for Hawkins-Kennedy, supraspinatus impingement. Some people, sorry guys, but some people just, they kind of do this as well. I've seen on YouTube people do this as well sometimes, and they put it through several angles and they check. You can just do it the way I showed you guys, and check the other side as well. And then the empty the can one, is that the one that's next?
Yes.
So empty the can, with this one you can do two things. You can simultaneously check for the strength of the supraspinatus, and at the same time you're checking for supraspinatus impingement. So if you can get you to go like this, and then go up again, or a little bit more like this actually, and up against my resistance. Any pain in the shoulders?
No.
So ask them if there's pain, and at the same time see how the strength is. See if one side is stronger than the other. So that would be empty the can test and supraspinatus impingement test.
Infraspinatus strength? Oh, sorry, we
Yep.
need to do drop arm?
We're gonna drop arm. This? Well, sometimes these people that have a lot of pain, you have to be incremental as well. Tell them, is that fine?
Mm-hmm.
And you can tell them, I'm gonna let go right away, and make sure you warn them, and you just. If their arm stays in this position, they're fine. That's a negative test. If their arm drops, or if they have any apprehension, that's a positive test. And if they can't maintain it in any way, if they're starting doing this, or if it just drops, yeah, all of those are signs of a positive test.
Supraspinatus and infraspinatus strength tests.
Yeah, the supraspinatus we did with the empty the
Yes.
can. Yeah. So infraspinatus will have you just go like this. So again, people like to do this. Oftentimes, make sure that the elbows are locked in, and tell them to externally rotate outwards against your resistance. Yeah, go again. Yeah, it just says which side is stronger. He's pretty even. Arguably, sorry, at the same time, if there's pain in the shoulders when you're doing this, that could indicate tendonitis in the infraspinatus. And then if you go the other way, the opposite to that, it's not in the book, this would be subscapularis.
Radial, median, and ulnar nerves?
You guys won't be tested on these. Do you want me to film these?
Oh, no, if we're not tested.
No?
We're not tested on what?
You guys are not going to be tested on the radial, ulnar, and median.
No.
Skip those?
Yeah, I'll
Okay.
skip those. Just give me 2 seconds here. So
And you're not tested on the vertebral artery as well, by the way, guys. We skipped that one as well.
Tinel's test?
Tennille's test. So there's two types, right? There's one for the elbow, one for the wrist. So this one for the elbow. Very simple. Find the olecranon and then find the medial epicondyle. In between there, there'll be a groove. So here you have there, and this is the groove. I usually like to do 2 fingers. You gotta hit decently hard. You can't just do this. That won't work. if they have serious like sudden zaps and strong neurological symptoms, that's a positive test. If you have the odd one, like an odd zing, that's arguably a negative test. A person who tests positive, they would have just both. With every little hit, they'll have neurological symptoms. That would be a definite positive test.
Medial collateral stress test.
Medial collateral and lateral collateral will be together, yeah? Okay. So, we're putting stress on the collateral ligaments. So, we're going to make sure that their elbows straight, their hands straight. Yeah. Make sure the elbows straight, extended. You want to have a little bit of give, that's fine. A healthy person should have a little bit of give, about 5 degrees. If it's past 5 degrees, that's a positive test. So I don't know if you guys can see it in the camera, but there's a little bit of give this way, and give this way. So in other words, when you're pressing and you're moving the hand medially, you're stressing the lateral collateral ligament. So this would be the lateral collateral ligament test. This would be the medial collateral ligament test. I'm putting stress on the medial collateral ligament. So again, medial collateral, lateral collateral. Most of the times you'd be doing it like this. It's about 5 degrees, that's a positive test.
Little Nigger's elbow. Gopher's elbow.
Yeah, let's do those. So same thing, just they correspond with each other really nicely. So basically, just make a fist, and like this, and you'll tell them to extend the wrist against your resistance. You'll be doing it like this, so extend the wrist. If they have pain in their elbow, that would be positive test for lateral epicondylitis or tennis elbow. And then the opposite, make sure their elbow is straight. Tell them to flex the wrist. If they have pain in their elbow, that'd be positive for medial epicondylitis. Or golfer's elbow.
Phelan's test.
Which one?
Phelan's test.
Just 1 minute. This is a nice simple one. People with carpal tunnel oftentimes test positive. People who don't even have carpal tunnel test positive for this one a lot. If you have any symptoms in your fingers, any neurological symptoms, tingling, numbness, pain, positive test. And if you go up to a minute and there are no symptoms, negative.
Median nerve tunnel sign.
So just like we did with this one on the elbow. Matter of fact, you could probably just do these at the same time. Go here, nothing, and then just go to the carpal tunnel. So if a person has any kind of numbness or tingling, I would just do those together, just to get them out of the way. So if there's any neurological symptoms in the fingers, that's a positive test, and oftentimes it does indicate carpal tunnel as well.
Finkelstein's test.
Yeah, so this. So this way. You will feel a stretch. A stretch is fine. You know when it's a stretch, it feels good. But if it's that tendonitis type pain, if it's uncomfortable, if it's very painful, that's a positive test for tendonitis.
Allen test.
Okay, so it's this one. You can probably be able to see on his hand if you were to zoom in, because his actually, so I'm going to go like this. So you're going to compress on the radial side and on the ulnar side. You're going to compress the arteries like this. Not too hard, don't like squeeze, enough to compress into, so just compress like this, and tell them, I like to say about 7 times, make a fist and open, make a fist and open. 7 times while compressing the arteries. So, sorry, 1 second. I should like this, I shouldn't be able to see if you can see the camera. Okay. And oftentimes their hand will become nice and white. So his is already pretty white. One more time. And I'm going to let go off the radial. 1, 2, 3, 4, 5. Around took about 5 seconds. It should be 3 seconds or under. It should be relatively quick. It's supposed to become nice and pink. Within 3 seconds, preferably under 3 seconds. This was about 5 seconds. Before it was roughly around even 6 seconds. So do it again, but just do the ulnar side as well. So press. and you can see his hands getting nice and wet already. Okay. 1, 2, 3, 4, 5, 6. Yeah, around 6 seconds. So he's positive for both of them, both for the radial side and the ulnar side. That's the last test.
Froment sign.
Sorry?
Froment sign. Oh, it's this one.
Does anybody have paper for me?
Yeah.
I'm here. I should be okay.
Here.
Okay. So you can do it on me actually. So I'm to grab a piece of paper and pull away from you. If they're doing that, that's obviously a positive sign. Most of the time you won't see that. Most of the time you'll see signs of compensation. They'll do this. They'll flex at their thumbs like this. So before they're holding like this, now they're holding like this. So press against me, and they start doing this. That'll be a positive. So again, one more time. Okay, that's a positive, and that's a positive. This is a negative. This would be a positive.
Will we be tested on Patrick's?
Yeah.
Yeah.
Yeah. That's a good one. Are we ready? We're Patrick's ready?
I think.
63. Page 63.
Yeah.
Okay. If I can show on your back. So this is to determine if the back pain, the lower back pain, is caused by SI joint issues. So the leg will go over top of the knee, just like this. Pressing down the knee. If you feel an end feel, don't force it. Who knows, right? And the other hand goes just on the ACEs like this. And then slowly open up the hips. So he's very tight. But if he has pain when me doing this, you don't necessarily need to touch the table. A lot of people can't. But if they have pain when you're trying to open up the hips like this in their lower back or in their SI joint issues, then yeah, that's an indication there are issues with the SI joints. And then you just do the same, just over top of the knee, one hand on the knee, the other hand on the ACEs, and open up. And if they have pain, then that's a positive.
Hip flexor and modified overhead test. Unless we're not tested on those.
Yes, you are tested on those. Is it okay if I get you to scooch down and have your knees off to the side? Just a little bit. Perfect. Were you here for this one?
I don't know.
Yeah, just move it back. So basically, tell them to grab one knee and bring it to their chest if they can. Just like this.
I am like.
So his leg is lifting up. So yeah, he's testing positive. He's getting off the table. So that's positive for the hip flexion test. However, this is modified. If we want to know if it's due to rectus femoris, tell them to straighten out their leg. No, sorry, keep well holding this position. Tell them to straighten out their other leg. So this is what should happen if it was rectus femoris. So in other words, just relax for a second. They'll bring up their leg and grab it. This leg will rise like this. Relax the knee. It'll rise like this, and then you tell them straighten out your leg. They straighten out their leg, and then it starts dropping. If it starts dropping, that's a positive test. It means that they have tight rectus femoris. If it doesn't drop, if it remains like this, it's a positive sign for tight iliopsoas, tight hip flexors. So once again, he lifts up his leg, the other leg rises like so, and then you tell him, okay, now straighten out the other leg. If the straightened leg starts to fall, that means that the rectus femoris is tight. If it doesn't fall, then the iliopsoas is tight. Does that make sense, guys?
Mm-hmm.
Okay.
Modified Ober's test?
Yes. It's okay if I get you on your side. Yeah. Put their leg behind them like this. If their leg can either touch the table, it would even better go past the table. That's a negative. If it cannot go past the table, or if it barely touches the table, that's a positive sign for modified Ober's test. Oftentimes it will have a corresponding iliotibial tract contracture with this one.
The QL length test. I think
It's
that's
1
the last
o'clock.
one.
It's 1
This is
o'clock.
the last
Yeah.
one.
Do you have a client?
I do. Well, no, I have an appointment somewhere.
You can go.
Okay.
Yep.
Wonderful. Thank you.
Sorry. QL length test.
Yeah.
Sit up. You know what? I'm not testing you on this one actually. In QL length test. Is there another one after that?
I don't think so.
That's it.
Probably.
I think there's one more. Was it not?
We're into knee after that, so I don't think
That was
so.
the last one.
Yeah.
Okay. All right. You're good.